introduction about our practice first. We've been practicing what's called integrative or functional or lifestyle or personalized medicine, what some people call alternative medicine, for the last 33 years here. So we have quite a bit of experience in helping people who have chronic issues and acute issues with as much natural therapies as possible. We're not big on pharmaceutical agents because we find that natural agents work very, very well. So tonight we're going to have Dr. Kyle Meyer, who's our naturopathic doctor. He's been with our team for over 3 years now. We're very excited to have him here. He completed a residency in naturopathic medicine down in Georgia, graduated from the naturopathic school in Portland, Oregon, a number of years ago. And he has been specializing in this whole area of medical cannabis, which he's going to discuss with you tonight, as well as other things he could talk about too. But anyhow, so we started using medical cannabis here because about a year ago, or a little less perhaps, because the demand was there. Patients started coming to us and asking us, do you use medical cannabis? And so we went out and got certified, so we're able to allow our patients to utilize it for certain conditions, which we'll be discussing tonight. So we're one of the few centers in the whole region that is approved to utilize or to give you the card, if we think it's indicated, for medical purposes. And so, for example, I treat a lot of cancer patients, and Dr. Meyer sees almost every one of my cancer patients if we think it's appropriate to use the medical cannabis. And there's many other indications, so I'll talk about that as well. So I want you to know that about once or twice a month we give talks here like this. They're free. You're welcome to come back. I hope to see you again. Bring your friends. I'm doing one in about another month from now, the 26th of February, with my other associate, Dr. Pichotti, and that's going to be on regenerative medicine. We're talking about stem cells, something called exosomes, something called peptides, which is exciting also breakthroughs in medicine. So we try to bring you the latest and greatest information here, and we change the topics almost every month. If you can't come, busy, whatever, we hope to post these on both Facebook and our YouTube page at some point afterwards. So, I'm glad you're here. Tell your friends about it. I think you're going to be in for a real treat tonight. And I'll introduce Dr. Kyle Meyer.
Thanks.
Sure.
So we're going to just jump right in. We got a lot to discuss. I have way more slides than I probably should, but probably the biggest difference with this lecture compared to the ones I've given in the past is going to be some of the research updates. A lot of research has been coming out, especially over the last 2 years especially. So I'm going to provide some research articles on that. A little bit of the history. The first documented use of cannabis was in 2700 BC. In Chinese medicine. So we do see that it's been used for a very long period of time as a medicine. We've also seen Egyptian texts use it for tumors. It's also been used in horses topically. In veterinary medicine, you can see it's been used by the ancient Greeks to help with wound healing. In herbal medicine, we call that a vulnerary property, which means it just helps with healing. And you can see this Egyptian or this ancient pot that has a marijuana leaf on it, just to indicate its use as a medicine. So in terms of cannabis in the United States, it was used as a medicine from about 1851 to about 1943. We used it as a liquid extract, cannabis sativa. That's, in my opinion, the best way to deliver cannabis as a medicine is through a liquid extract, either an alcohol or glycerin extract. But in 1936, they started to try and suppress the usage of hemp in all of its purposes. In the late 1700s, actually, over 90% of our paper was used from hemp. So now, after we started to criminalize the use of this and ban the use of it, that's what's made us use more trees, etc. But hemp has hundreds of purposes. It can be used in industrials and textiles, etc. But they started the government in the United States started propaganda to try and adopt legislation to make it illegal, and started some of the things like Reefer Madness, which was a video that would basically have people smoke cannabis in it and then they'd murder people, and that was just to help create fear to use this as any type of medical intervention. And then there was the Marijuana Tax Act in August of 1937, which basically said you need to have this specific tax on cannabis, but it actually was legislation that would ban the use, production, and sales of cannabis. So the government had put out many different types of things like this to try and make sure that people wouldn't use this as a plant. And they'd say it would cause you to have murder and insanity and death, and all of those things were false. Now certain people would have the psychosis from this plant and they would go a little manic, and people who have a family history of schizophrenia need to be extremely cautious, and that may be one of the only contraindications, which means one of the only incidences where this may not be used as a medicine. But this was the Reefer Madness, video. If you look at it, it's very hysterical at this point. But it is something that, the government had put together to try and prevent the use of this as a medicine. So this is how it was delivered. It was delivered as an alcohol extract. We still use alcohol extracts of herbs these days. I personally, before this lecture, took an alcohol extract of a couple of herbs to help me adapt to the stress of having public speaking or a lecture. And I also used a little bit of CBD as well beforehand, it was very fitting for the lecture. But I usually do that before a lecture because I get a little nervous. So the U.S. Pharmacopoeia had it in the formulary until 1941, at which point it was removed. But that's how it was delivered. You can even find it. I have an old Merck manual. A Merck manual is a book that tells you this medical condition you use this for. Well, I have an 1899 Merck manual, and cannabis is riddled throughout it for many different medical ailments. The endocannabinoid system. So this is a system that was discovered to be activated by cannabis by Robert McCullum, a researcher in Israel. He went to Israel because that's the only country that allowed him to research cannabis. But the endocannabinoid system is a system within our bodies that was activated by cannabis, but it's found throughout it. And there's many different types of things that can activate or deactivate this system. We find it in any mammal, but we also find it in sea squirts and nematodes and every single vertebrate. Any type of animal that has a vertebrae, that's what we find this system in. And it's estimated that it evolved over 600 million years ago just to help us to adapt to stress. So this system helps all of our other systems work as efficiently as possible. It helps our adrenal or our stress system. It helps our hormone system, not only our sex hormones, but our thyroid system. And there's some suspicion that there's an endocannabinoid deficiency in a lot of people. So a little bit more. So cannabinoids influence a person's relationship with their external environment. So socially, it'll alter human behavior by promoting sharing, humor, and creativity. So you see a lot of people in art that have used this to help with their creativity in terms of expanding their minds. It also, autophagy, which is basically programmed cell death, is mediated by the cannabinoid system. So that's something that's critical for preventing any types of inflammatory conditions, cancers, etc. So it's definitely a reason why cannabis and various other things that activate this system can benefit inflammatory conditions. We can also see that cannabinoids decrease the release of activators and sensitizers from injured tissue. Basically, when you get, an injury, your brain says, hey, fire, fire, because we want to protect this area. We want to bring blood flow and healing elements to allow things to get calmed down. And so what it does is it stabilizes the nerve cell and prevents excessive firing. That's why it's extremely helpful for what we call neuropathic pain, which means pain of a nerve origin. It also helps to calm nearby immune cells, so that tells us that there's some influence on immune conditions, whether it's cancer or autoimmune conditions, or even immune deficiency syndromes that it can be beneficial for. So this is an oversimplification of where the cannabinoid receptors are. And so the cannabinoid receptor 1 is in the light blue, and that's typically in our nervous system. So we see it riddled along the spine and the brain. And that's why cannabis, when you smoke it, creates the euphoria, the head high, is because it's very dense and very high in THC. Now, typically these CB2 receptors, cannabidiol doesn't really directly activate it. It kind of modulates those receptors. But we have CBN and various other cannabinoids in the cannabis plant that help to activate these CB2 receptors, which are riddled throughout the gut. So whenever we're talking about gut issues, we've got to talk about CBD, especially a higher density of CBD versus THC. So there are CB1, CB2, CB3, CB4. CB2 is suspected to be the reason for why people who use cannabis regularly typically have a lower body mass index. What it does is it helps to modulate appetite. Instead of making you have the quote-unquote munchies, it actually prevents you from having that. It upregulates your metabolism and it downregulates some of your hunger and fat storage. So we'll talk about a research article that goes through that, a research update in a little bit. But we see that these receptors are everywhere, but CB1's predominantly in the nervous system. So if you have anything related to the nervous system, THC can be helpful. So whether you have anxiety, or you have brain metastasis, or you have something that's creating excessive firing like pain that's related to the nervous system or the spinal cord, that's where things that are going to activate CB1, which is typically THC driven, that's where we would want to use those. Now CB2, that's where we're looking at the immune system. And so that's where we're going to use it a lot more often in immune-related issues like autoimmune conditions and cancers. There's also other receptors that they're starting to discover, CB3 and CB4, but we know very little about those. So you don't need to use cannabis for your endocannabinoid system to be activated. We actually make two types of cannabinoids in our body. One is called 2-AG, the other one's called anandamide. And these are things that are downregulated if we have certain issues. And I'm going to go to the next slide. We'll talk about how we impact our production of these within our body. So these endogenous cannabinoids activate these receptors without making you high. So we don't have to use cannabis as a medicine and expect a high sensation. There are ways that we can deliver it, and it's honestly the only way I like to recommend it to people, by not making you high but giving you symptomatic relief. And honestly, it's an art because everybody responds differently. And we'll talk about why people respond differently with edibles, which is one of the main delivery methods that I recommend, because honestly, no medicine is smoked. So that's why it's not something I'm in full support of. But there's a time and a place for everything. So we can see these receptors are embedded in cell membranes throughout our body, but especially in our nervous system and in our immune cells. But our bodies make these, and one of the big things that it makes the anandamide from is from triglycerides. So if we suppress our triglycerides, or we don't have enough omega fatty acids, we are not going to make our own endocannabinoids. And so this system is not going to work to its full efficiency. So these are some things that upregulate and downregulate this system, and also the production of our endogenous cannabinoids. So first is omega fatty acids. The reason why is because it's precursors to making those endocannabinoids. So if we have, typically here at the Magaziner Center for Wellness, all of our providers run what's called an omega check, which looks at your omega fatty acid status to see if you have a sufficient amount of these. Now, although the normal reference range is 5.5 for these, for the omega check for your omega fatty acids, our ideal will be to be over 8. And the reason is because of cardiovascular risk reduction, but also so we have plenty of these precursors to make these endogenous endocannabinoids. We also have herbs, things like echinacea, also help to stimulate this endocannabinoid system. So that may be related to its immune aspects. It helps with CB2 receptors. Also chocolate, so a lot of us love chocolate. Another reason to consume some healthy, vegan, fair trade chocolate. So chocolate is another big one. And then stress reduction techniques. And I found it interesting that the research says enjoyable exercise as one of those things that helps to upregulate that system. Well, when we get that runner's high, that's suspected to be related to production of your endocannabinoids and stimulation of the endocannabinoid system. That's suspected to be one of the reasons for that runner's high. Other things that inhibit this system is chronic alcohol consumption, trans fatty acids, because that's going to imbalance your ratio of omega-3s to omega-6s. We have refined sugar, foods fried in vegetable oil, because we also, once again, are creating more of that omega-6 relationship instead of those healthy omega-3s to build our endocannabinoids. Pesticides and other endocrine disrupting chemicals. This is going to disrupt any hormone system or any system that we're dealing with. So here at the Magaziner Center for Wellness, we also deal with a lot of hormones. So Dr. Magaziner is recently in the book by Suzanne Summers, and he does a lot. He's done decades of work with using sex hormones and managing those appropriately. We also deal with thyroid hormone. That's something that I deal with a lot because I have an autoimmune thyroid disorder called Hashimoto's, so I work with that pretty extensively because I feel you when you're having issues. You know, I've had those issues too. And then chronic stress. So that obviously has a huge impact. Obviously, these things are all stressors on the body, right? So anything that's going to stress your body out is going to stress and affect your production of endocannabinoids. And this is just a terribly pixelated version of how we can see triglycerides help us to make our endocannabinoids like 2-AG. So that's why we don't want to artificially use statins to suppress the production of our fats too much, of our cholesterol particles too much. So typically we'll start to even see suppression of sex hormones when we get our cholesterol below 140, our total cholesterol. So the entourage effect is the reason why this is such a great medicine, and the reason why you need to make sure you know the source. The entourage effect is basically means that the combination of everything in the plant is the reason why it works so well. So we can't extract THC, we can't extract CBD and expect the same exact clinical benefits to this as a medicine. So what we have is you know, the various endocannabinoids, which I'll probably bore you with in a minute, and then we also have terpenes that we need to make sure are in our products. But basically, we see that, and this is with all of herbal medicine. So, you know, things like periwinkle, we extract that for, vinca alkaloids for treatment of cancer. But we know that when we use the whole plant extract, we see better clinical effects to certain things, and especially when it comes to cannabis. So we need to make sure that we're using whole plant medicine, and that's also why we want to make sure if you're using CBD that it has full spectrum and that they give you a certificate of analysis to ensure you have terpenes in there. Terpenes are the things that make flowers smell good and essential oils work. So I'll discuss that a little bit more in a moment, but I think the CBD product we have here is by far one of the best because of the profile that they give us. So this is some evidence of the endocannabinoid the entourage effect when it comes to cannabis. We know the terpene myrcene, it helps to reduce resistance in the blood-brain barrier, so it allows those endocannabinoids to pass through easier. We also know pinene, which gives us that pine smell, helps to counteract the negative effects of THC. So sometimes we see short-term memory loss, things like that when it comes to THC. But when we have these other terpenes in there, we see a reduced adverse effect from that. We also see the combination of pinene, myrcene, and caryophyllene help to improve anxiety symptoms. So, you know, we know CBD can help improve anxiety symptoms as well. So that's why, you know, we want to make sure that we're using this in concert. And then we can see linalool and limonene combined with CBD can help with acne. So there's a lot of different applications we can use here. So there's a difference between hemp and marijuana. Hemp is the male plant, marijuana is the female plant. It's the same plant, just one's male, one's female. Female has beautiful buds or beautiful flowers. The males, these are basically like, they're pods. Basically, they're like testicles. So those help to secrete and pollinate the plant so that if you want to say, you know, have a low CBD and a high THC plant crossed, or a high CBD, high THC plant crossed, you're going to need a male plant to pollinate it. But this is where a lot of the THC is. One of the biggest differences is this is extremely high in CBD, very low in THC, usually 0.3% or less. This is extremely high in THC and very low in CBD, typically up to 33% THC. Now, back in the day, back in the 50s, 60s, and 70s, cannabis only had about 5 to 7% THC and had about 1 to 3% CBD. Now it has up to 33% THC and 0% CBD. So no wonder why people aren't able to use this as a medicine. Even people who have said, oh yeah, I used to smoke a joint when I was, you know, the hippie ages, whatever, and I try to do it now and I completely bug out. Well, no wonder, because it's almost 10 times the amount of THC that you're getting and much less CBD to help counter those effects. So that's one of the main differences. Also cultivation, so this you don't have to really do anything with. you just throw it in a field and let it grow. This, you need to be very cautious about mites and fungi because it's a moist, sticky plant, and mites are extremely common when it comes to this plant. You also have to dry it appropriately because when you dry it, that allows the THC to increase. It converts THCA to delta-9 THC, etc. Also, we've seen that hemp has been more acceptable. That's why we have CBD on every corner, but cannabis is not as acceptable in terms of using it on the market. And then research is definitely limited with regards to those things. So, but research is definitely coming out more and more now that places have become recreational. So if we did not have CBG, we would not have THC. So there would be no CBD, no THC if we didn't have this cannabinoid. So this is by far the most important cannabinoid anywhere, because if we didn't have it, we wouldn't have the other properties of the plant. So basically, CBGA, which is the alkaloid component, it's the most important chemical compound because we wouldn't have any of the other stuff without it. So we're going to see it a lot higher in typically more of the fresh plant. Basically, it's like how stem cells in our body can become any cell. This is like the stem cell of the cannabis plant. So it allows the production of those cannabinoids. It has some anti-inflammatory properties, anti-cancer properties. We don't see many strains that have it in it just because most of the strains have already converted it into THC or CBD. So then we have CBG, just without the acid, and we do see some benefits to this for specifically glaucoma and irritable bowel diseases. It does not have any psychoactive properties. The biggest strains that have this is Magic Jordan, Destroyer, Mickey Kush, and Allen Wrench. Those are also very high in THC, so you need to be cautious. But it has a calming effect, this specific type of cannabinoid. But it also has antifungal, antibiotic effects, so you can use it topically. We have THCA, which is by far one of the most important ones when it comes to cancer. This is, in an ideal world, we would use freshly juiced cannabis plant for every cancer patient, but unfortunately we don't have access to that in this state because we're not recreational and we don't even have growing privileges even if you do have a medical marijuana card. But what happens is the drying process converts this to the psychoactive delta-9 THC. And so if you don't dry it right, or you rush harvesting the plant and you don't put it in the right environments, you're going to have an okay cannabis instead of a fantastic cannabis. So drying the plant helps to convert this into the delta-9 THC. So you could see cold pressed or freshly juiced cannabis is the best delivery. Typically, we're trying to get to 100 milligrams of THC with cannabis patients. That is a whole lot if you're using delta-9 THC. If you're using THCA, you're seeing non-psychoactive effects. So you're able to get to that dosage without creating the THC overdose. And we'll talk about what those side effects look like. But these are by far the highest THC strains, and sometimes you'll find them in a THCA format, but particularly in a recreational dispensary. The only one I've seen in the dispensaries here is going to be the WAPA, Bruce Banner, and the Pearl Girl Scout cookies in our dispensaries. But this is the bread and butter. This is the one that does a lot. If there's any brain involvement, this is key, because whether you have metastatic lesions from cancer, or you have anxiety, or you have nausea or vomiting. The thing with vomiting, though, is that if you overdose with THC, it's going to stimulate those vomiting receptors instead of suppressing them. And it's going to cause a side effect of what we call cyclic vomiting syndrome. And so we see this in a lot of people, especially, unfortunately, vets, who are using this in an excessive amount to try and get control over their PTSD, but don't really understand using lower THC amounts to get that PTSD on more frequent intervals, or taking it as an edible instead of just using the mega dosages of these high THC plants. Critical for eating as well. So if we've got an eating disorder, specifically bulimia or anorexia, or we have the appetite loss related to chemotherapy or radiation to the head and neck area, this can be extremely beneficial to help with trying to prevent some of that cancer cachexia or muscle-related weight loss. Definitely a lot of anti-cancer support properties, definitely a lot of anti-emetic, anti-nausea properties, and then spasticity. We see an equal ratio of CBD to THC be very helpful with using a drug called Sativex through GW Pharmaceuticals, which is a 50-50 THC CBD spray. But we'll get into dosing and things in a moment. So there are synthetic THCs on the market. They have a much higher side effect profile than the THC products that are used from whole cannabis because of that entourage effect. It's those other plant components that are preventing this from having and giving you an adverse effect. So we've got two. We've got the Marinol, which is most commonly used for HIV and AIDS and nausea and vomiting with chemotherapy. It's a Schedule 3 drug, so that's a DEA schedule. Understanding that cannabis itself is Schedule 1, which means the federal government does not recognize it has any medicinal properties. At some point, it would be great to have that rescheduled, but that's going to be a long, arduous fight. But that's just to put it in perspective. You know, we have cannabis as a whole plant is up with LSD and cocaine and MDMA, but we've got these synthetic drugs of cannabis that are, you know, much lower scheduled, and you can use them for certain medical conditions. So the Sesamet is actually a lot, it definitely has more side effects from what I've found, you know, clinically with a lot of patients that I've spoken to, as well as in the research, although it is Schedule 2, so it's up a little bit higher. And this is what that product looks like. It comes in 2.5, 5, and 10 milligrams. And honestly, anybody cannabis naive should always start with 2.5 milligrams of THC or less in conjunction with CBD. So just going back to this diagram so we know where we're going this way. We just went the other way, so we're going to go to CBDA. And so that's the precursor to CBD, which everybody's, you know, heard a lot of lately. And so we've got various different strains that can help with giving us that type of CBDA, a lot more CBD in Ringo's Gift and AC/DC. AC/DC has been available through our dispensaries here in New Jersey. So has Sour Tsunami, Canna Sue, and Harley Sue. Those ones are typically more of a 1-to-1 ratio of THC to CBD, but they can be, I think Harlequin was also available at the dispensary a few months ago. But it does have some anti-cancer, anti-inflammatory effects. You can use this in a food, or you can also use it, like it says there, you know, you can use it topically, or we could use it orally. So a lot of inflammatory conditions. We see some benefits for nausea and vomiting, but this is really the main one. CBD. So we know a lot about CBD. I'll go over some research in a bit. I have a couple of research updates. We know that there is data on it now. When that video was put together, it was in the early 2000s, so it's a little bit outdated, but I felt like that video really just drives home the message that this can be used safely as a medicine, even in young children, and it can be a lifesaver, as you saw in Charlotte's Web. And now you know where Charlotte's Web comes from, and the beautiful story that is. Ringo's Gift has a very similar story as well. That's another epileptic patient that needed a high potency CBD, and they named that one after Ringo. So the conditions that can benefit from it, honestly, pretty much any condition could benefit from CBD. We see a lot of anti-inflammatory and pain aspects to it. We also see some neurological and psychiatric conditions, anxiety, depression, etc., and then spastic conditions like MS. There's no doubt MS is beneficial for using CBD. So this is the CBD drug that's FDA approved. It's Schedule 5, so it's much lower on the scheduling. So you still do need some, it still is a controlled substance, but it's much less regulated. So in 2018, this was delivered for Dravet syndrome, and it's likely it was developed because of Charlotte's Web story. But we know that there's much more side effects. We see liver enzyme elevation just because of the synthetic nature of the CBD. We also see diarrhea, sleepiness, and a significant reduction in appetite. And we won't see that when we use whole cannabis. Even if we use cannabis-derived CBD, we're still going to see some benefits because there's that 0.3% THC we need in it to help with that entourage effect. So these are all the different types of impacts that it can have. There's a couple of research studies I have in here showing its antiviral effect, antibacterial effect, as well as its anti-prion effect. Prion disease are basically infectious diseases that happen in the brain, like mad cow disease, and this is something that can be extremely beneficial even for that. When we don't have many options, traditionally speaking, this can be one of them. It could be sedating, but that's very dose dependent. Depends on the individual. Some people start getting sedated at 5 milligrams CBD. Other people need about 600. So, there's a huge difference with how people respond to this. Huge anti-anxiety effects. I have every single one of my patients fill out what we call a GAD-7 and PHQ-9. Those are anxiety and depression questionnaires. And I'd say at least 60% of my patients have improved anxiety scores on their follow-up visit. And it's not always CBD that we're using. We could be talking about mindfulness, or we could be talking about SAMe, or CBD, or L-theanine, or GABA, or 5-HTP, or magnesium threonate. We could talk about a lot of different things, but regardless, we're seeing anxiety scores change. And we know, based on the research, that there are huge anti-anxiety effects from this. The problem, once again, is it's dose dependent. The one research study showed social anxiety when it came to lectures, and it was extremely beneficial for them, but that research study used 300 to 600 milligrams of CBD, and that's gonna break your wallet for sure. We do see some anti-nausea effects, huge anti-seizure effects, also dose dependent. What I've seen clinically is typically it takes about 100 to 300 milligrams of CBD to get seizures completely eliminated, and I've seen a few people not need their anxiety medication or their seizure medications at all after that. Pain relief support, also dose dependent. Definitely does have some bone density improvements, so anybody who's postmenopausal, it can be very helpful for helping to improve that. Definitely helps with some of the small intestine contractions. So, if we have a condition like small intestine bacterial overgrowth, or also known as SIBO, or various other issues regarding, spasticity in the intestines, we see that there's huge benefits there. Immune modulation, absolutely. Blood sugar properties, a little bit. It depends on the individual once again. And then huge neuroprotective or brain protective properties. It would be, in my opinion, that anybody that gets a concussion should heavily dose with CBD for about 2 to 4 weeks after their concussion to help protect themselves from having memory deficits. I had a concussion last summer. No, it was about 2 summers ago, and I was a surfing thing, and the board hit me, and when I was caught under a rip curl, I got in our hyperbaric oxygen chamber, loaded up with CBD, and within about a week and a half, 2 weeks, I was clear. My brother and my dad, ironically, both had a concussion around the same time. My brother did it also surfing out in California, but he took several weeks, and my dad took a few months. But I attribute it to the hyperbaric oxygen getting in there every day and using higher dosages of CBD. But I still take CBD every day, 15 milligrams, for helping to improve my pain and inflammation. I got into this field because of back pain, and that's what I still struggle with to this day. But it definitely helps to keep things under a little better control. But it doesn't work for everybody. CBDV also has some very, very potent anti-seizure effects. So we see that can be found in various other medical strains. Now, as the world of cannabis research starts to evolve, we'll be able to say, hey, use this strain for this condition. We're not there yet. We're getting close. There is, like a lavender strain, has linalool, which is an terpene that's extracted from lavender, but is also in the lavender strain of cannabis, and that can be extremely beneficial for anxiety. But it's hard to really know consistency among strains, etc. But the CBDV definitely has calming effects, and we do see that in many of our good quality CBD products like the one we carry. THCV is also gaining some research, so it doesn't really have any. This is typically where it'll convert after you've had old weed sitting in your cabinet that you stole from your kid 10 years ago. That's typically what you'll find this high in. It's much less psychoactive, still has some psychoactive effects, but it helps people feel more stimulated and energized, but clear-headed and energetic. Who doesn't want that, right? So, and it also has some bone density effects. So we would definitely want to have that in any CBD product that we're delivering. It's mainly in the sativa strains from Africa, but it can also help with inhibiting LPS, lipopolysaccharide, in the intestines, so it's great for appetite modulation and also gut repair. CBN is mildly psychoactive, so like I said, we're starting to learn more and more around these things. And it's definitely appetite modulation and anti-inflammatory effects and sleep and pain benefits. CBC, another non-psychoactive. This one's highest in the Three Kings strain. Definitely has some bone density benefits, antifungal and antiviral things. So we'd want to see this more in our topical CBD products, especially if we're using it for infections or wound healing. So these are the terpenes. I'm just going to talk about a few of them. It's definitely the largest group of secondary plant metabolites. It's not essential for viability, but it helps to enable plants to prosper in their environment. So it has natural antibiotic effects, has natural, antifungal effects, so we don't need fungicides or pesticides to keep plants on it. That's why this plant is so sustainable, because it has its own compounds to protect it from anything. So when we grow it outdoors, it's a lot easier for it to be managed because it's got its own compounds. When we grow it indoors, that's an artificial environment. Sure, we can control everything, but then we need to be worried about the moisture that it collects and the molds and the mites that can start to get on this. So the aromatic oils, the terpenes are the aromatic oils that make this smell good. All of these little specks here, those are all crystals. Those are all the terpenes. Those are also the highest concentration of THC, by the way. And we'll talk about some extraction methods. But pinene is huge, so we can see this in Blueberry Dream and Black Jack Herrera. Jack Herrera is definitely available. That was my brother's favorite strain, but unfortunately he's no longer with us, and I'm dedicating this lecture to him. Today is 6 years from when he passed away from a fatal heart attack at the age of 35. So it's always a tough day for me, but that's why I do lectures, to help distract myself. And this is a topic that if it was more accepted, and I think he'd still be around, but can't dwell on that right now. Alpha pinene is found in pine needles, rosemary, basil. So that smell when you grind it up or you cook with rosemary or basil, some of that is alpha pinene. And the beneficial effects are stress reduction, brain protection. So that's why when we took our exams in naturopathic medical school, some of us would have a sprig of rosemary on our desks to help us, concentrate and think clearly and try to relax ourselves, so that we didn't have too much test anxiety. Also great anti-anxiety, anti-asthma effects, and then it improves respiration. So I think, longer term, once we realize how we can, utilize specific plants with this, maybe we can vaporize them into a nebulized format and, help with asthma. We've got beta-pinene, so we see this a lot in cumin, which is the picture in the back. Definitely has some sedating properties and diabetic and cancer properties. Also in Jack Herrera, Strawberry Cough, and Blueberry Dream, mentioning those because those are available in our dispensaries here in New Jersey right now. Limonene, so we talked about limonene a little bit. That's like a lemon or citrus type of aroma. We do have a lot of that in the fruit rinds. Like when we pull a little clementine apart, we're going to smell some of that limonene. Has a lot of great anti-nausea, antidepressant, and appetite modulation effects, but it helps to improve our mood while reducing our stress. Typically seen in more of the higher THC content. Most of these are all available with the exception in New Jersey's dispensary, with the exception of Durban Poison and Jack Ripper, but Sour Diesel, OG Kush, and Super Lemon Haze are available, and those are also great for pain relief. This is a big one for pain, so we find it in mango and lemongrass, thyme, and hops. Has more of a sedating, relaxing effect, and we see that in the White Widow, Skunk XL, and the Special Kush. This is the most abundant terpene in cannabis, which is where it's found mainly in nature. So that's why, and it makes up about 65% of the terpene profile in many of the strains of cannabis. Linalool, beta-caryophyllene is the only terpene that attaches to the endocannabinoid receptors. So it has huge pain, anxiety, anti-inflammatory effects, and it's very, very, very good for alcohol withdrawal support. And if it's good for alcohol withdrawal support, it's good for opioid withdrawal support. So we see this in Super Silver Haze and Skywalker. Skywalker OG and Albert's Super Silver Haze is also available at our dispensaries here in the state of New Jersey. I've also listed some of these, and it's in black pepper, so you can see black pepper in the back. But I've listed some of the vaporized temperatures because you can set your vaporizer to a certain temperature to help with promoting inhalation of these specific terpenes. And vaporizing is by far the safest way to deliver smoked cannabis because it reduces the combustion in the mouth, which means the heat, and therefore it's reducing what we call oxidative stress in the mouth. Oxidation is when a wrench rusts or an apple turns brown. When we have that happen to our cells, no matter where they are, it creates damage, and when we have damage, that could leave us susceptible to inflammatory conditions, including cancers. So although cannabis has been proven to not cause cancers at all, even smoked cannabis has been disproven to not cause lung cancer. We have linalool, so this is a beautiful lavender field. If you have a chance to go see one, they're amazing. There were a lot of them out in Oregon when I was doing my schooling out there. Very relaxing to just look at them and watch the little leaves sway. Very good for mood enhancement, sedation, and relaxation. So once again, we do have access to lavender, which is one of the #1 strains I recommend to people for anxiety effects and also insomnia. Then we have humulene, just one or two more of these. But this is in hops, so hops are in the back here. They're known to bitter beer, but they also have very estrogenic effects. So we have a hop extract here that we use for menopausal syndrome. It's an extract from hops called 8-PN that has great effects on modulating estrogen. So it's good for increasing estrogen in women who are menopausal, and it's also good at reducing estrogen in those men who are converting their testosterone into estrogen. And I've done a couple of case studies on that, on reducing estrogen conversion in men and preserving testosterone. We see great anti-cancer, appetite modulation, and pain relieving effects from this. And so we do see that in the ones we have available here in New Jersey is White Widow, Headband, Girl Scout Cookies, Skywalker, and Sour Diesel. This is the last terpene we're going to discuss. This one is typically in lilacs, eucalyptus sap, and then the pine trees. So we have a citrus or floral aroma to it, great antimicrobial effects, especially anti-malarial effects. And so we can use this as an edible variety for cancer, inflammation, malaria, and also antibiotic anxiety effects. So I'm just going to go through some research updates. This is what's going to differentiate a lot of the things that I've said before in my lecture and saying now. These are mainly 2019 or 2018 studies. Two that I didn't include, one of them was a survey of about 1,500 people taking CBD at night for bedtime. What they found was that people's time to go to sleep was reduced from about 40 minutes to 15 minutes, and they found every one of them woke up rested. Especially, I think there was an 80% of them had felt rested after using CBD for sleep, versus in the beginning, people who weren't using it for sleep, there were only about 5% to 10% of people who felt rested. So definitely a lot more things coming out. There was also a study I saw this morning where they used they used CBD and they used a functional MRI on 13 people. It's from King's University in Europe. I believe it's in London. And what they found was those people who are psychotic, they found that when they gave them a memory task, it's something to remember, they found that their neural pathways when they used CBD were the same as somebody who was not psychotic. So it basically what they said was this shows that this can help to change psychosis in people who are psychotic. Whereas in the past, like the government has tried to tell us, this can create you to be psychotic and create psychosis. But we're seeing with CBD, we're not seeing that impact. And it's a small study, but they did functional MRI. It's a really expensive study to have to run functional MRI on everybody. But these psychotic patients had a significant improvement. So we're going to go through each one of these. So 2019 Journal of Pain. They revealed that headache and migraine ratings were reduced by nearly 50% after using cannabis. And that was 12,000 sessions for headaches and 7,000 sessions for migraines. So pretty significant. If it was a sample size of 10 headaches, I would say, no, this probably isn't going to be something I'd want to talk about. But about, 20,000 headaches, and it said men reported a greater reduction than women, but cannabis concentrates were related to larger reductions in headaches than flower. We're going to talk about the concentrates. We don't have much of an access to that here in the New Jersey medical marijuana program, but we do see that in the medical marijuana program in Pennsylvania. There's also evidence for tolerance to the effects of cannabis on migraine, which just meant that evidence for medication overuse headaches was not detected. So basically, when you use something like Topamax to prevent your migraine, you may need more of it to be able to prevent that migraine from coming on. We don't see that with cannabis. The same dosage works all the time. CBD-induced disruption of fear. So this was showing us that basically CBD helps to disrupt memory consolidation up to 1 hour after a fearful episode. So if we have a traumatic event, this helps us to forget and not dwell on that traumatic event. And this was in an animal study, but it was basically looking at some of the interference that we see in our nervous system regarding our brain and our dorsal hippocampus, that we see that our bodies, when we use CBD within 1 hour of that fear or that PTSD event, we see that we don't dwell on it and we move on and we don't allow it to have an imprint in our body forever. We also see that it can be used for antibiotic resistance. So 2019 study showed that it can help modulate bacterial membrane vesicles, and basically it would be helpful in the co-application with certain antibiotics, depending on the bacteria they're dealing with, to improve the antibiotic activity and to reduce antibiotic resistance. And we know that MRSA is a big problem and it can cause a lot of deaths in people who are immune compromised. So this can help with especially helping to improve the efficacy of those antibiotics. This was something that showed that we can use CBD to help with reducing the craving related to heroin or opioid use disorder, and so it goes to show how beneficial this can be used for opioid use disorder. I've had a lot of experience with people having opioid use disorder within my family, and so this is definitely a big issue. I'm sure every one of our families have been hit with somebody that we know that has had an opioid use disorder, but this definitely showed some clinical benefits to using CBD. It's a little bit of a higher dosage, 400 to 800 milligrams, but hey, anything that's going to help with this opioid epidemic is a win. We also have cannabis use in constipation. So what this study showed is it was a survey of over 9,000 patients, and 30% of them it showed that people who used cannabis had a 30% reduced risk of developing constipation. So it goes to show some of its impact on bowel motility. We do have, the other way. Sometimes it can help with bowel motility in the other direction, but it was always suspected that this only causes diarrhea, but that's, or it only helps with diarrhea, but that's false. It also helps with constipation as well. So that's just something that, something for us to be aware of. And also, even in, where was it? The Congo. They use cannabis as a tea. They harvest it and they use it as a tea for diarrhea and constipation. And just mash up the bud and leaves in some hot water over a boiling pot, and that's how they drink it. Also, it was suspected that cannabis reduced semen production, and that if you were trying to conceive, that you don't want to be using cannabis. Well, what they found is that there is the presence of 2-AG, which is one of our endocannabinoids, in our testicles, as in our human testes. So in women it's, in women it's the ovaries, and men it's the testicles. But what they found was that this 2-AG helps with the release of semen. So it doesn't always suppress the production of semen. It could actually help with the production of semen. So that's something that's always been touted as, oh yeah, you don't want to use that if you're infertile. But there's some benefits to it now that we're finding, because it modulates these systems. Also, the safety and efficacy of cannabis in the elderly. So it has been found to be extremely safe in the elderly population. What they found was that 18% of the people who used this over 6 months had stopped or reduced their dosage of opioids. And that's huge. I mean, anything we can do to stop or reduce our usage of opioids is critical. But this 18% of them had stopped or reduced their dosage of opioids, and their main side effect was dizziness or dry mouth. And so you can see that our study finds that the therapeutic use of cannabis is safe and efficacious in the elderly population, and it may decrease the use of other prescription medicines, including opioids. So it goes to show that this can be delivered safely. You just need to be able to have the right person to direct you. I have a patient from Pennsylvania who I recommended something to purchase. They didn't listen. They purchased something that the dispensary told her to get, and she overdosed in THC, had 8 hours of vomiting throughout the night. Triggered cyclic vomiting syndrome. She said, oh, I don't ever want to use this as a medicine. She had stage 4 cancer. She's pretty cachectic. She went from 198 pounds to 120 pounds in the course of about 3.5 years, and she had been losing weight. And I said, look, you need this. And she had mets to the brain. And I said, look, you need to use this to stabilize your weight and support your brain mets. So we started with a little bit of lower dosage, and now her brain mets have gone down in size and number, and her appetite has improved. And so she's actually eating 2 meals a day instead of skipping all of her meals and continuing to lose weight. So it is safe in the elderly population, and that patient is 67. So cannabis users have a lower body mass index. So people think, wow, what about the munchies? Well, it modulates appetite. If you have a high THC strain, sure, you may have appetite stimulation, especially if it's more of an indica, which is the sedating, higher THC types of cannabis. But if you have a sativa, you might be vacuuming the house, wiping down the counters, and not even thinking about eating. So it really depends on your response to a specific strain, but there's no doubt that there's a inverse association linking cannabis use and obesity. There's also an inverse association with cannabis and BMI. So typically people who use cannabis regularly have a much lower BMI. This study was using people who had 77% of them never used cannabis, and it studied them over 3 years. And the people who did not stop using cannabis had a lower BMI than the people who had stopped using cannabis over that 3-year period. So it can, in the future, we can maybe look towards this for weight loss. The theoretical explanation is a rapid and long-lasting downregulation of CB1 receptors. Those are the ones in the brain and the nervous system that help with the THC appetite when it comes to cancer cachexia, which following acute exposure, the consumption reduced energy storage, which means basically fat, putting on fat and storing fat, and it increased metabolic rate. So it made your metabolism work better while not making you store fat. So it's definitely a lot of interesting data. And that was on 33,000 patients. So that wasn't, just like 400 people. That was a significant sample size. We also see various double-blinded, randomized, placebo-controlled trials, which is the gold standard in medicine, showing a significant improvement when you use THC and CBD compared with placebo versus just THC. So they saw a reduction in more than 30% from baseline in the pain scores of patients with an incurable cancer. We also see that it can be helpful for anxiety disorders and OCD disorders and PTSD. One of the big things that we can qualify people for anxiety and PTSD here, but in other states like New York, you can't qualify people for anxiety, but you can qualify them for PTSD. This is the prion disease study, so this was from 2007. So it helps to protect the brain and its neurons from the accumulation of these prions, which is basically like a mad cow disease. And then these are various other studies that I don't have time to go over. So this could be effective for a variety of different treatments, especially neuropathic pain. We see the medical conditions that can benefit from cannabis here: appetite loss, cancer, inflammatory bowel diseases for sure, wasting syndromes in HIV and AIDS. I think that this can also be something, let's say an NFL athlete or a soccer player gets a concussion. I think that they should be using some type of cannabis medicine for their recovery, in my own opinion. And it should be removed from their, list of things that they can't use. Because there's no doubt that it has brain protection, and it's my opinion that it can prevent chronic traumatic encephalopathy, or CTE, which causes a lot of football players and other players, but especially football, to become depressed and suicidal. Like unfortunately, a great football player, Junior Seau, who had this, played for the Chargers, and he committed suicide, and he shot himself in the chest because he wanted people to study his brain, and because he was depressed and suicidal, and he was a happy-go-lucky guy. He said, I know that all those concussions did something to me. And honestly, I've had at least 25 or 30 concussions in my life, so I'm lucky to remember half the stuff I'm talking about right now. CBD, definitely great for epilepsy, inflammation and anxiety for sure, and wound healing, absolutely. I have a, CBD salve. We have a topical CBD for people who have certain areas that may be painful. I have somebody that I spoke with that was a former patient of mine. Her husband just had post-herpetic neuralgia. He's been struggling with it. She was asking about what he could do for it. I said, hey, even though you're not a patient of mine anymore, do you have any topical CBD? And she said, yeah, actually we do. We've been taking it. He's been trying it orally, but it's not doing anything. I said, try to rub the CBD on it. The next day, she messaged me on Instagram and she said, wow, it worked like a champ. He doesn't have nearly the pain he had with using the topical CBD for his post-herpetic neuralgia. So we can use it topically in certain areas of neuropathic pain. So this is what we can qualify patients for the New Jersey medical marijuana program. I like to call it cannabis because cannabis is the botanical name. Marijuana is what the government had made up to call this plant just to patronize it and create a negative connotation around it. But basically, you need to be a New Jersey resident. That's the biggest thing. You need to be a New Jersey resident. You need to have one of these conditions. Typically, we see anxiety, cancer, and pain most commonly. Dysmenorrhea or painful menstrual cycles was recently added to it last year. We also have opioid use disorder, migraine headaches. It can be extremely beneficial for seizure disorders, obviously. Now, anyone that's under 18, we won't qualify just because you need a note from your pediatrician or a qualified specialist. But anybody over 18, 18 or older, we would be happy to if you have one of these qualifying diagnoses. Now, we do ask that patients bring in that diagnosis from a doctor instead of having us, run through whatever the diagnostic criteria are for these conditions, just to help streamline that process. But it's very quick and easy. We can get it done in our day. But the reason what we do here is more than just cannabis. So, if you're coming for cannabis related to anxiety, we're not just going to be giving you cannabis. We're going to be looking at your hormones. We're going to be looking at your vitamins, your minerals. Your hormones include your vitamin D, your sex hormones, your thyroid, your cortisol, and make sure there aren't any environmental toxicities. I like to discuss cognitive behavioral therapy in people who are anxious and talk about, hey, these are your cognitive distortions. These are things that you need to stop doing that's going to put you down that rabbit hole of anxiety. One of the biggest ones is disqualifying a positive. Somebody gives you a compliment, you say, oh, they're just being nice, oh, you don't mean that. No, take it. And accept that compliment. Don't disqualify the positive like that because you're just going to end up setting yourself up for more, issues. So this is what we can give. So basically you register online, you pay the state $100, $20 if you're a vet or a senior. That's for a 2-year card. So you buy the card for 2 years. That's all you have to pay the state, is once every 2 years you need to pay the state. But then you have to come into us to qualify you for a 1 to 12 month period of time. We don't qualify anybody for more than 3 months when we start out because we want to check in and make sure that you're delivering the medicine safely and that it's effective for you and you're using it. We don't want you to qualify yourself to get it for somebody else. You know what I mean? If you're using it, great, but we want to make sure that how you're using it is effective. So we'll qualify people for 3 months, and then if we feel like you're don't need as much guidance, then we may qualify you for 12 months after that. It's a maximum of a 3 ounce per month limit, which is excessive. I don't know of anybody that could use 3 ounces a month. You wouldn't be able to even take the joint off of your mouth each month to be able to smoke 3 ounces in a month. But it's probably for preparation of foods and things of that nature, making can of butter, can of oil, etc. A lot of states that are recreational have like olive oil infused cannabis. Then you just throw it on your salad and you've got your medicine right there. You are not allowed to grow, and you are allowed to carry up to 1 ounce maximum if you are transporting it. These are some specific dosings for cannabis and CBD that I've found to be helpful and that some of the research may direct people towards. But you always, always, always want to go low and slow. I put a picture of turtles in the back because they're slow, and that was my brother's favorite animal. But we see epilepsy, we have all of these different cannabinoids that would be extremely helpful if we can get those specific concentrations in there. Seizure, we see in rats, the studies show 100 to 600 milligrams per kilo, which is really high, but clinically I've found it to be around 100 to 300 to put a halt to seizures. CBD for pain, typically we're going to go 5 milligrams per kilo. That's on the research. You can get as much pain, you can get pain relief in as little as 15 milligrams. It's really going to depend on the individual. Anxiety and social anxiety disorder, 300 to 600 milligrams. I should have probably modified that to say probably 5 to 30 milligrams every 4 to 8 hours could be extremely helpful. Parkinson's, you're going to need pretty mega dosages for to try and help with the spasticity and the tremor and the pill rolling and the shuffling gait, but you also need to look at the toxicities. You need to do intravenous glutathione, you need to detoxify, etc. Insomnia, 40 to 160 milligrams a night can be helpful. If it's not working for 160 milligrams a night, then you've got to start dealing with your adrenals. That's your stress hormone, and if you're not dealing with the stressors that are causing that, then you need to meet with an integrative or functional medicine practice like ours. MS, definitely want a 1-to-1 ratio. There's, like I said, GW Pharmaceuticals has a product called Sativex they're out of Great Britain, and they're seeing great improvements with this buccal spray in a 1-to-1 ratio. So we do see that MS responds very well to 1-to-1 ratio of CBD to THC. And cancer, we want 100 milligrams and 100 milligrams. Ideally of THCA, there's no way you're going to get a cannabis naive person to 100 milligrams of THC. It's going to take you over a year, probably 3. But if you get THCA and you can juice that fresh plant, you can get there a lot quicker because it's not psychoactive. This is the product that we carry that I believe is one of the best products out there because they give us a certificate of analysis with more terpenes than any other product that I've seen so far. So this one has at least 4 of the terpenes that I mentioned in my lecture. Most of the other brands that I've seen don't have that many. So I usually use the liquid, and I use a quarter of a milliliter, which is 25 milligrams. If it's for anxiety, I'll use it 2 to 4 times a day. If it's for sleep, I'll probably use 0.5 to 1 milliliter at bedtime. So the acute effects, definitely appetite changes, definitely changes in heart rate, definitely changes in blood sugar, and then also dry mouth and changes in reaction time. So that's everything that I tell patients when it comes to using cannabis as a medicine, is that you can't drive with it to start until we figure out if it makes you feel funny. I tell people to take it at dinner time to start because that's when it may drop your blood sugar, it may make you a little shaky or make you a little hangry, hungry and angry. Some people get that way, so maybe you're picking up what I'm putting down. But the heart rate can also go up or down. Typically that's going to be THC and CBD dependent, so you want to definitely have some CBD in there. Impaired concentration in irregular users, but normalizes deficit in concentrations in habitual users. So people who are using it all the time, they don't have that short-term memory loss. They actually have better memory when they use it. But people who are cannabis naive, they're very forgetful. Impaired working memory, behavior, judgment, so similar to alcohol. What I relate 2.5 milligrams of THC to is 1 alcoholic beverage. So 1 shot, 1 glass of wine, 1 beer is the equivalent to about 2.5 milligrams of THC. Now the subjective effects of using smoked cannabis last about 2 to 4 hours, but if you eat it as an edible, it can last very differently. We have a range of about so what happens is when we eat cannabis, it converts from delta-9 THC to delta-11 THC, and that's either going to not work for people at all, or it's going to work 300 times stronger than the cannabis that you would deliver as a smoked variety. So basically, it's either not going to work very well, or it's going to fly you sky high and you're going to bug out, and you're going to need to just wait it out. Sit in a cold shower or something. So some of the safety, we need to know the source, get a certificate of analysis. We need to know the percentage of THC. Any cannabis that's grown in a medical dispensary has to be organic. So that's something they can't slap a USDA organic on, but it has to be grown organic. When you get recreational, there's no guarantees. All bets are off. So you're going to see a lot of pesticides and fungicides when you use those because you got mites and you've got fungus that grow on this plant very easily. Also, should be avoided in adolescence. That's why it should be regulated at anybody 18 or 21 or older, because it can still have a potential for addiction. That's the only area that it's been potentially studied for addiction, and it has a potential to lower IQ in adolescents. It also should be used in caution, if at all, in people with a family history of schizophrenia, and you should not use high doses of THC in cardiovascular disease, especially if you have an arrhythmia or if you have coronary heart disease or coronary artery disease. So something to be very cautious about. And then cannabis hyperemesis syndrome is that cyclic vomiting syndrome that can be happening when you get THC. CBD, got to know the sources, got to know the amount of CBD, got to know the concentration of it, and also the presence of any other cannabinoids. So that's why you want to look for full spectrum. If you look back at this, you can see full spectrum right on it. So that helps you to understand that you know what you're getting. It's also safe for anyone at any age as long as it's administered under the doctor's supervision, and you want to go slow and slowly increase up. So this is a psychiatrist who worked at Harvard, very conservative. He had a son who is about 6 years old, going through leukemia treatments. He couldn't eat. He just saw him wasting away. He said, you know what? Forget it. I don't care about the conservative mindset of Harvard. I'm going to give my son cannabis. He can't eat. He's sick. He gave him cannabis after his one treatment, and on the way home, his son said, hey, can we stop for ice cream? And he's like, what? He wants to eat something? And he saw a dramatic improvement in his son's quality of life as well as his appetite. And he's like, you know what? Forget about all this. This is definitely a medicine. I saw my son use it. He was very young, but it was very effective for him. And Dr. Grinspoon said, one of the exceptional features of cannabis is its remarkably limited toxicity. So when we look at toxicity, because we always want to make sure that we're doing something that's safe and that we're informed about it, if we look at all of these other things, we have a lethal dose, LD50. That's what we use for every pharmaceutical. It's called the lethal dose that will kill you, basically. So nicotine, you can barely see the mark there. Caffeine, aspirin, Vicodin, NyQuil, Ambien, Tylenol, alcohol. Cannabis, you will never overdose on cannabis. The reason why you will never overdose on cannabis is because all of these cause respiratory suppression. This doesn't impact your respiratory receptors in your brain, brainstem. So that's what makes this different from everything else, is that it will never cause respiratory depression like any of these other drugs. So why is alcohol allowed and not cannabis? Who knows? So we've got different routes of administration. This is a volcano. This is a PAX. This is by far one of the best delivery methods through vaporization. Definitely cools the heat going into your mouth. We also have various other ways. We have concentrates. We have dab, shatter, wax. Those are extremely high THC concentrations, typically in the range of about 70 to 90% THC, which is insane. And that's where we start to get, totally recreational, in my opinion. But it can be beneficial, as we saw in that one migraine headache study. It can be a little bit more effective for migraine headaches. It works almost instantly, so that's why I tell people, look, time and a place. If you've got anxiety or acute pain, this can help rescue you, but we're going to use an edible to try and give you more of that long-acting pain or anxiety relief. Edibles ingested can take effect within 30 to 60 minutes and can last 8 hours in some people. Some people it lasts 3, some people it lasts 11, so it really depends. Once again, it depends on how your body metabolizes the delta 9 THC into delta 11 THC. That's honestly something I just learned about 3 months ago from a medical marijuana conference that I attended. And then we also have oral capsules and medications. So this is your flower. Advantages: rapid delivery, doesn't require additional processing behind drying after harvest, and it does have a flavor. The disadvantages is it's smoked, it smells, tolerance develops, so you need more and more over time, and the dosage options are typically limited to 10 to 1 or 5 to 1 to 1 ratios. Solvent extracts, I think this is the ideal delivery. Unfortunately, we're only just starting to be able to get access to this in the state of New Jersey's medical marijuana program. The onset is about 30 to 60 minutes. Basically, you're soaking cannabis that's been dried into alcohol or ethanol, and it's removing and then you need to remove the plant material, filter it, and evaporate it. So it's definitely more time consuming. Unfortunately, you lose a lot of your yield and you lose a lot of valuable material through the processing. Very limited dosage options, and the taste is pretty horrendous. But The advantages is you can do drop dosing, so you can say, hey, look, I want you to start with 1 drop a night for 3 nights in a row, and then go to 2 drops a night for 3 nights in a row, etc. Also, we have no risk of toxic residual chemicals like we do in what we're going to see butane extraction next. You have a lower cost of manufacturing, and you get the extraction of all of those terpenes and cannabinoids. This is one of those solvent extracts or solvent-free extracts. Probably one of the most notorious solvent-free extracts is this dry sift, also known as keef. What it is it's basically those little crystals on the outside of the plant. Typically there are grinding herbal grinders that will have 3 layers, one to grind it on the top, second is to open it and take that fresh leaf, and the third at the bottom is for the dry sift or the leaf, or the keef rather. And so you can see that this is what's left behind when in screens with the complete trichome glands. Then we have all these other ones which are typically related to some type of solvent extraction, which can be dangerous. So this is a solvent extraction gone wrong. This was an explosion in someone's kitchen. Basically you're using butane, the same thing you use in lighters, to be able to extract that cannabis. CO2 extraction is far better and far safer, but it's extremely expensive. So you can see how intricate the system is for a CO2 extraction. You're also getting less terpenes in that way. But you have much less waste and you get a higher yield. And then no residual toxins. So this is what's used in the dispensaries in New Jersey to extract what they're extracting. This is what's used recreational typically. It definitely has lower equipment, lower running costs, people doing this at home, higher terpene content so you get more flavors, and it could be combined for a more broad chemical profile, but it's unlikely that you've extracted 100% of that butane and propane. So you are getting that as you dab it, which is basically you heat a healing element and then you put it on there and it instantly vaporizes into a smoke. But this is extremely dangerous to process it this way. And most people who buy those excessive amounts of ounces, they're doing this stuff at home on their own. They're stuffing it into a column, stuffing all the cannabis in there, putting it exposed to butane, and then trying to vaporize the butane out. But it's unlikely you're getting 100% out. Then we've got edibles. So typically it's ethanol extract, and then they infuse it into some type of, or you can do, an oil or a butter, etc. The problem is the dosing is very inconsistent, so you may need a higher dose for a therapeutic effect, which may be costly because those packs are sometimes, $60, $80 a piece. Length of effects could take a while. 30 to 90 minutes, it's the most we've seen. We can see that you can last in your system for 4 or more hours. The advantages is you can control dosing a little bit, so you can say, oh, well, I'm only going to bite half of this gummy, and that'll give me 5 milligrams, yeah.
Are there edibles in New Jersey?
There are lozenges. So this is the only thing that's available right now in New Jersey is the edible lozenges. That's the way that I start with anybody. I tell them to cut it into a quarter, and then I have them dissolve a quarter at dinner time, and then try it for 3 nights in a row. If you don't feel funny 2 hours later, I tell them to try it in the morning with breakfast on a day they won't be driving. But yeah, this is the only place that I've found. Also, Breakwater up in North Jersey has some lozenges as well, but those are the only 2 facilities I'm aware of that have access to lozenges. Cartridges you always want to get from a dispensary because of vitamin E acetate being put into these cartridges and causing vape-induced lung injury. And then we have these oils, but the inconsistency with these makes it difficult to dose, because if you try to push like a rice-sized kernel of an oil out of a syringe, you're going to push out like a blueberry size, and then you're going to get sky high. You know what I mean? So I don't use this until I build people's tolerance with this. And then obviously I'll use cartridges for discretion for trying to build up tolerance. But there are 6 dispensaries in the state of New Jersey. This is the one closest to us, and we've toured their factory a half dozen times, and they're booming. They're doing really well. They went from 1 building about 18 months ago to 4 warehouses. So they're definitely exploding. Now the metabolism of cannabis interacts with a lot of drugs. The ones you do want to avoid, Wellbutrin if you're using CBD. I had one patient that was hospitalized by using CBD because she neglected to tell me she was on Wellbutrin after I recommended it to her. And what it basically created was this type of headache, blurred vision, changes in hearing issue, and a lot of agitation. So she was hospitalized and some chest pain, and they said, oh, well, it's probably your CBD. It's the combination of both. What happens is CBD inhibits the metabolism of bupropion or Wellbutrin, and so it stays in your system longer, and therefore side effects to that medication, the side effects go up, and those side effects would be to that medication. And you want to avoid Topamax if you're using THC, because that's used for migraine headache prevention, because it can also, if you're using it for seizures, definitely avoid it, but it may work synergistically with Topamax because of its additive effects. But if you're using Topamax for seizures, then you may see a change in seizure control. Now, this is based off of the pharmaceuticals that are, side effects. So this is from, Epidiolex, and this is from Marinol. So it's unlikely that if we had the whole plant compounds, we don't need to worry about these side effects, especially if we're going low and slow. But based on those drugs, that's what we see as a contraindication if you're using those drugs.
It's just Topamax, it's not other...
Correct. Yeah. Then we need to watch out for some of these other synthetic cannabinoids like K-spice. It was estimated that in 2011, over 28,000 visits to the emergency department were as a result of K-spice, Black Mamba, Kush, and Chronic, which are synthetic cannabinoids. So we definitely want to make sure that we're keeping it out of the reach of children there. And then Thomas Edison once said there were never so many able, active minds at work on the problems of disease as now, and all their discoveries are tending towards a simple truth that you can't improve on nature. So regardless of what we take out of this compound, out of this plant, there's no doubt it's better than the synthetic version of what we're trying to extract. And with that, I'll have questions. It's my daughter. I love her. So I thought I'd throw a really cute picture up there on her. So if anybody has any questions, I'll pass around the microphone so anybody listening will hear. Anybody?
I have a question.
Yeah, hold on, just grab this microphone real quick. I think so. Yeah.
Have you found any thing that's useful for bipolar to help with manias?
So I would say
To help
I would say CBD may be used, but that we need to be really cautious with what medication people are on when it comes to bipolar.
What if they're on no medication?
What's that? No medication?
Yeah.
It can. We're just going to have to use, some type of questionnaires to try and monitor how you're doing and go very low and slow. Because
do you have it available now?
What's that? CBD?
Well, the stuff for the bipolar.
Yeah, we have the ECS Therapeutics, the CBD I had up there. That's what I would use, but I'd start at a low dosage because that's going to be the most potent CBD you can get on the market right now. Nobody on the market sells more than 3,000 milligrams of CBD in a bottle, and that's what we have. There's only one other company that sells it but they can only sell it to Brazil, and that's a 5,000 milligram. But in the United States, you're only going to have access to 3,000 milligram CBD at the very most. And so that's what we carry. It's in a 30 ml bottle, so if you take 100 milligrams a day, it lasts you 30 days. Now, I think that's a little excessive to get started, but usually I start with about 10 to 25 milligrams, which would be around 4 to 10 drops of that solution. But yeah, it can be very effective for any type of psychosocial disorder, even bipolar, but we need to be cautious about what medications people are on, and then also we need to use the low and slow dosing method.
Lisa?
Do you have testing to identify whether or not you have a receptor? Like you were talking that your CB1 and your CB2 receptors you could actually have issues with. Mm-hmm. Do you do testing to find out what you have issues with and therefore determine which medications would best suit an individual?
Not at this point. Unfortunately, the research, is not there yet. I mean, we're just discovering what hits on these receptors, let alone how we can test people's blood for these receptors. And Doc Ethan Russo had put out a position paper regarding what's called clinical endocannabinoid deficiency, which means that a lot of us probably have this deficiency because we have a crappy diet, we've got poor lifestyle, we're not getting enough omega fatty acids, we're not doing enjoyable exercise, etc. And so it's likely that we're down regulating our own production of those endocannabinoids. So it would be more beneficial for us to even be able to measure those inside our body instead of having to measure like the receptor activities. You know what I mean? In laboratory science testing, we don't really look and see if receptors are working unless we're looking at genetic studies. And right now we don't know of, what type of genetics could be negatively impacted or positively impacted by the use of this as a medicine yet. But I think, more importantly, the future is going to be around, what strains have what terpene contents and what conditions are they going to apply to. I have a couple of hidden slides on what I found clinically, like get this strain if you have anxiety, get this strain if you have, seizure disorder, get this strain if, you have pain condition, etc. But the science just isn't there. So that's why I also have people come in after 3 months, because if you're using a smoked cannabis for pain, let's say, then I want to know that worked for you. Okay, you're using daytime relief of pain for this because it's not making you sleepy, but then you're able to go to bed and have pain relief with this other strain. That helps me to compile data so I can share it with everybody else, because right now we don't have the science, and there's a lot of inconsistency among strains because people are like, oh, that looks like OG Kush, let's just put that name on it, and unfortunately that's what makes it hard to deliver as a medicine, is the inconsistency with the naming of the strains and then individual response.
One last question.
Are the strains different in different? Because I saw you saw a headband in New Jersey. In Pennsylvania, it's called 707 because I'm a Pennsylvania patient.
Right.
So it's called 707 headband over
Right.
there. Are they the same thing from one state to the next if the names are different?
If the names are different, that means they're a cross between two different strains. So let's say, right now they have sour diesel, but they also have silver haze. Well, they have an Albert's super sour diesel, and it's super silver haze with sour diesel. So, that's where the names are typically the crosses of the different strains that they're putting together. And it's really hard to keep up. I mean, there's so many, and there's not even data on the genetics of the seeds sometimes that are being produced. They're all in-house cross hybridizations. So like there was a recent strain that came out, Toast R Strudel from the New Jersey dispensary, and I'm like, where the hell did this strain come from? Exactly. And like there was one that was like Toast R Strudel 2, Toast R number 5. And it's like, there is no number 5. There's no genetics for it anywhere on Google or anywhere on the cannabis forum. So it's like, where did this strain pop up from? Because they've even done genetic studies and they've found that sativas are not true sativas sometimes. That's the uplifting, the stimulating type of cannabis strain. But indicas typically are true indicas. So when they look at the genealogy, they're like, no, this didn't originate from a true indica, or this didn't originate from a true sativa. So it's really, really, really hard to make it as a medicine, especially because of that. Because we can't even say, the same headband here is going to respond to you the same headband that you have over there. Because that 707, that 707 might be a sativa dominant type of strain, and the headband here will put you to sleep, but that one will keep you energized cleaning your house.
It actually helps with the migraines.
Yeah.
The headband works.
Right.
But it's interesting.
Yeah.
It is different from state to state.
It's
and growers.
exactly.
Thank you very much, Dr. Meyer. It was terrific. And as you guys can see, it's a very complex, complicated field. And it's not just about going down the street to your local 7-Eleven or Wawa and buying the CBD. That's not going to be quite what this is all about. And I just want you to know there's a lot of offices, medical offices in the area or elsewhere that have somebody, you go there and they just have a nurse that has almost zero knowledge at all in this kind of thing. And I'm not picking on nurse, it could be the doctor as well. But that's why Dr. Meyer is seeing patients, because he truly has a very in-depth knowledge. And I want you to, as you guys can see, you can see it right now, he does. So thank you for coming. I'm going to ask Kim to give you all, everyone who hasn't, did anyone not get a handout yet? Okay, so most people did not. Okay, so we're going to give you, each of you a handout tonight. We appreciate it. It's one of is a questionnaire, just to fill in the questions or answers to the questions. We appreciate it because it gives us feedback. Also, it talks about some of the future upcoming events we have here, and hopefully you'll come back for more. If you enjoyed tonight, we hope you'll come back. Tell your friends as well. Did you want to say something about the products tonight too? Because I don't.
Oh yeah, the ECS therapeutics products that we have, like I said, they're definitely one of, especially this liquid. It's the highest potency that you can get in the United States. The reason why I like this once again is because it tells us, the company sends us their certificate lab analysis that says we have all 4 of these terpenes. We have no pesticides, no solvents, no fungicides, nothing that has been, no heavy metals that have been found in this product. And that's honestly what you should get from every single natural product you get, is a certificate of analysis or a COA. Anytime a patient brings a supplement in, I'm like, okay, well, let me email it. Just give me a minute. I find the company. I email them right away. And if they tell me they want to share their certificate of analysis, I say, well, then I'm not going to send my business to you for my patients, because I don't care if it's proprietary. I want to know that I know what they're getting. So this company has all of the cannabinoids. They've got at least 7 of those cannabinoids that I've discussed. They've got at least 4 of the terpenes. And then obviously they have, the concentration of the CBD. This is a topical, similar to what I told one of my former patients to use for her post-herpetic neuralgia for her husband. That worked very, very effectively. And then we have capsules, 25 and 50 milligrams each capsule, that are available. Can you give me a discount? We'll give 10% off tonight for anybody that wants to purchase those. I don't remember the prices, honestly, so you'll have to check with the front desk.
All right. Thanks so much. Kim is at the front desk to give each of you your packets. So you can pick that up there. If you're interested in purchasing any of the products, let her know that. And everyone drive home carefully, safely.
Thank you.
You're very welcome.
Thanks for coming.